Hello and welcome to another edition of Transforming WHO, a video series where I talk to colleagues inside WHO and outside about the work we do in the World Health Organization and how we try to transform our ways of working. And today here in our studio in WHO headquarters in Geneva, I'm joined by my very good colleague Maria Neira, who's the Director for Environment, Climate Change and Health. And welcome and thank you for joining, Maria.
Thank you, my pleasure.
First, a little bit about yourself. I mean, you have a long career in public health and with WHO, originally from Spain, medical degree from Oviedo in your country. But you quickly went into and shifted into public health. You worked in the field in the 90s and in Central America and Africa, very much in communicable diseases. Then you joined WHO working on communicable diseases through the 90s. Yes. Then you went back for some years to your own countries as a leading in food safety, I believe, in Spain. And then you rejoined WHO headquarters, I think actually 20 years ago, Maria.
Absolutely.
As director of basically the current function you have now on environment and health. So that's a long, distinguished career in public health.
Well, thank you. Definitely very much rewarding what I had as a professional experience. I was trained as a medical doctor, then specialized on a very sophisticated hospital in Paris on endocrinology. I thought all my life would be on a hospital because I was by vocation an endocrinologist. But then I went to a refugee camp in Central America with Médecins Sans Frontières, and then I discovered public health because you cannot keep doing only clinic work. You need to go as well of what are the causes of those diseases, and this is where I discovered my passion for public health. I've been working in all wars, in unfortunately conflicts in Africa and Central America. But then I arrived in WHO, I think with some background, strong one on what that means to respond to outbreaks, to work on the causes of the diseases and how we can promote health more than just to cure our patients. And then, yes, I have this experience in Spain, very rewarding as well, because then you see a government inside. I was Vice Minister of Health and in charge of this Food Safety and Nutrition Agency, and happy to come back here because for me WHO is home and where I feel so proud to be, and I have been dedicated.
And thank you for joining. And today in the conversation we are going to tap into your huge experience and knowledge, especially in the field of environment and health and also climate change. But we'll start with one of the very big determinants in environment and health, which is air pollution. Air pollution is a big killer and it's a global problem. We'll just look, we have the first slide up please here. Which is basically the whole world, and that's showing the levels of air pollution. That's measured in many different ways, but one of the key indicators is the concentration of what we call fine particulate matter, which is PM 2.5. And the greener it is, the more air pollution we have. If it's light green, it's approaching the level that is acceptable. Even many of the places which are very light green in this map exceeds the WHO recommended level, which is 5 micrograms per square meters. And it's actually, I think, less than 1% of the population who actually live in very, very safe environments. So air pollution is a big killer. If you just take the next slide, which is an infographic issued from your department on air pollution and health. And this is basically showing that we have annually excess death, excess mortality around 7 million. Air pollution affects many different organ systems, even the brain, the heart, the lungs. Half of that mortality is from pollution inside the homes, another half is outside. Huge burden in Asia and sub-Saharan Africa. So that's sort of laying out the thing here. So you worked with this for 20 years. What have been the challenges? What have been the successes?
Well, challenges is that we still have every year, and it's very frustrating 7 million premature deaths due to exposure to air pollution, to the bad quality of the air we breathe. And it's not because we don't have the scientific evidence telling us. We have the evidence proving where are the areas where the levels of air pollution are very high, what are the interventions that work, what are the legislation that work. We have proof that at the city level you can do a lot to promote sustainable transport or to reduce this energy efficient. We need to transition to clean sources of energy. So it's not by lack of knowledge, but probably the fact that there is no political commitment to react to this massive public health issue, which is represented by air pollution, is one of the risk factor, the most important one now, and we are not responding at the level of ambition that will require the dimension of the problem, and not at the speed that will be required. And another important thing is that air pollution and climate change overlap in the sense that most of the responsibility for this air pollution is as well responsible for...
With the fossil fuels,
exactly,
basically.
The combustion of fossil fuels.
But you spoke to sort of the political high-level recognition, etc. Some critics might say it came a little bit late to WHO. We have the first resolution in the World Health Assembly, I believe, in 2015, speaking to environment and health and focusing very much on the determinants and the science, reducing the use of harmful fuels in homes, which is a big driver of why we see this, especially Asian sub-Saharan. So it's basically how do you heat your home and cook your meals, and you use dangerous fuels, etc. So we had the focus 10 years ago. We are making progress. I believe the first high-level meeting on this in 2018, and there was a second high-level meeting just a couple of months ago in Cartagena, where you went.
Yes.
So are we making some progress? Where do you see the progress being made in some
Definitely we see progress. We are not where we were 10 years ago, and the evidence is there. We are accumulating now evidence because you show on your graphic the impact on our respiratory system, cardiovascular system, but brain. We are now accumulating a lot of evidence how air pollution is affecting our brain as well. And this is really a very important part of our work now, to make sure that everybody understands that this is really touching every part of our body, and we need to react to that. A couple of months ago, we were in Cartagena de Indias in Colombia, incredible conference, global conference on air pollution and health. And I say incredible.
More than 100 countries attended, I think, 500 participants.
It was really 750 participants, more than 100, all parts of society, and different sectors that needs to contribute. Energy sector, transport sector, of course mayors were there, architects, because they have, and of course health professionals. 40 million health professionals before the conference joined a call on saying we want clean air. So a pediatrician can treat a boy or a girl with asthma, but they need as well to ensure.
I believe some of the governments, even at the meeting, were committing to reducing air pollution. I mean, the governments of India, the United Kingdom, Colombia, Brazil, several in that meeting committed. Are these commitments ambitious enough, in your opinion?
You know, the level of ambition is never enough when you are talking about public health. So, but still, we have more than 50 very strong commitments, not legally binding, of course, but we will be able to monitor that and scrutinize and confront it. Some of the commitments were about reaching WHO standards on air quality, according to our air quality guidelines. Most of the commitments were about to reduce by 50% mortality, health impacts by 2040. Some commitments were done at the city level on intervention on sustainable transport. Other commitments were about reaching zero neutral on the health system. So a lot of commitments that we will be following.
We just saw
now.
the infographic. I mean, a premature mortality annually of around 7 million. I mean, compared to many other killers like communicable diseases, the biggest killer in communicable diseases, TB, malaria, HIV in total, is less than that. I mean, so why are we not focusing more on environment and health?
Well, this is the question we are asking ourselves, because 7 million premature deaths due to air pollution, but if you put all the environmental risk factors together, the environmental risk factors that can be modifiable, then the mortality that you could reduce is 13 million. So we could avoid by 25% and reduce by 25% the mortality every year if we invest on environmental health interventions that have proved to be effective, good for the economy, tackling the causes of climate change, tackling the causes of air pollution, reducing exposure to certain chemicals, and increasing access to safe water and sanitation.
But like you already said, it's very much outside of the health sector. I mean,
Absolutely.
we can certainly see the implications, and we have the science in the health space, so to say, but it's in traffic, it's in energy, and it's in many other sectors of society. So it needs an all-of-government approach. Is that one of the barriers here?
It's one of the opportunities, I would say, because when you use the health argument, and this is what we have been telling all the COP negotiators, on climate change, we are now giving them the health argument for climate action. And we are convinced that the health argument is the most powerful. The moment somebody understands that there is a connection between an asthma case and the level of pollution in the city, that moment that the patients are convinced that the citizens are putting a lot of pressure on their governments, and that can advance. So yes, but the health community has a huge responsibility because the price is already paid by our lungs, by our health, and our hospitals. And the
so
cost
there's a good
is enormous.
Business case for
exactly.
that. Before we move into climate change and leave air pollution, just one maybe success story or potential success story. Maybe you can explain. Let's just pull up the next photo, please. And this is basically a map of the city of Paris, the capital of France, which is a huge city. And I remember going back when I was younger, when visiting Paris, the traffic was terrible and the air quality was terrible. And basically, this is a map over, I think, 2 decades showing the improvement of air quality in the big city of Paris. Gradually we see how bad it was, and then gradually we see it improving and improving, and then looking fairly nice for a big city. So what are the root causes of the success story here? What did they do in France?
Well, I'm very happy to say that Anne Hidalgo, who is the mayor of Paris and one of the most responsible for this transformation, she always said that she's using the health argument. We have the opportunity to discuss with her a few years ago, presenting her the health benefits that she will obtain by cleaning the air, by making sure that people will be able to have a more active lifestyle, reducing obesity, reducing sedentary lifestyle related. She went through a very difficult political situation. As you can imagine, there were a lot of conflict of interest against that. But here is the result. Here is the success.
So what did they do in Paris?
Sustainable public transport systems. Making sure that they will reduce traffic in certain areas, more green areas and green spaces, obviously promoting the biking lines and the walking lines. Did you see the river now? It's completely different. People can go there.
Any success stories emerging from Asia where we see a huge impact and some big cities?
Fantastic one, Soren. A fantastic one that was presented at the Cartagena. I was so happy to see the slide presented by the Vice Minister of Health in China, where he was able to prove, and we have all the scientific evidence, so it's not just a greenwash or anything. They have reduced dramatically the air pollution in the big cities in China, and it has been, you have a demonstration, even if you go there, you feel it already, your throat is not suffering. And in that slide, he was proving the decrease on the air pollution and the still increase on the GDP. So proof that you can reduce pollution while still having an increase on your economic development, which is the argument that sometimes represents an obstacle, but as you can see, it's a fake obstacle.
Wonderful. Moving on to climate change and health. Man-made climate change is certainly very high on everybody's agenda and the global agenda, the consequences of that. And also the health consequences and what health systems can do has emerged, I would say, in the last maybe 15 years, been high on the agenda. I think in WHO it was first recognized in a World Health Assembly resolution 2008.
2008, yes.
But we have to come into recent years before it really achieves a much higher agenda. I believe we have these annual global meetings, the so-called COPs on climate change. And it was not until, I believe, 4 years ago in the Glasgow meeting that health was recognized as a separate tract. So now there's a health dedicated program, a health day on all the COPs, but that's only 4 years ago. So it's sort of, and now with the recent new strategy for global health that WHO accepted in the Health Assembly last year, the General Program of Work, the GPW 14, this is one of the 6 priorities.
Yes.
So we are getting there. Some critics might say we were late.
No, I don't think so. I think if we manage to have in Glasgow for the first time on a COP a health commitment is the result of many years previously of work. As you say, the first resolution on climate change and health was in 2008. And it was, we got a lot of support from the member states, which was a kind of positive surprise for us. Then it's true that the allocation of resources has always been very modest, but still, I think our role on environmental health and climate change included is on influencing. And when you have a very good argument and interventions and everything, to influence what you need is to go to the COPs and say, okay, here's the health argument. And as a result of that, we have now a decarbonization of the health system, which is something, the health system contributes 5% to the global carbon emissions, which is not a small one, it's a big one. And now
if you compare it to a country, it's like top 5, right?
It will be on the top. So now we are decarbonizing the health system, which is part of our, contribution.
So that's basically health systems taking responsibility for basically the man-made
Careful
climate
there,
change.
because some countries are saying, I don't need to decarbonize because I'm not even generating any, emission, which is true. And those countries, they don't need to decarbonize, is correct. What they need is to gain access to clean sources of energy. So what we are doing there is to make sure that we influence and we push for those health systems in Africa, in Asia, to gain access to photovoltaic. There is no reason why we don't have a solar panel in each healthcare facility in Africa.
Which will also make the health facilities more resilient to climate change.
Less dependent.
Exactly.
The cost of the diesel for the diesel generators in
but also
the
disruptions by flooding and all other climate effects. I mean, you will have the flooding disrupting energy, etc. I mean, so it's actually a multi-pronged approach of decarbonizing healthcare system, making health systems more climate resilient, and then of course also addressing the health effects of man-made climate change.
This is the positive part, because we are telling all the negotiators, here are the health benefits that you will obtain if you tackle the causes of climate change, if you mitigate. And the health benefits are coming from nutrition. You will have a more sustainable food system, and therefore reducing mortality by lack of nutrition. The second one will come from access on accelerating transition to green, renewable sources of energy. And again, the health benefits will be the reduction on the deaths caused by air pollution. And the third one is the transformation of our urban spaces, our cities, a place where 70% of the population in few years from now will be living there. So we need to make sure that we have a sustainable
and many other health
transport.
effects. I mean, spread of vector-borne diseases,
heat waves,
heat stress, and even the mental stress of climate change effects.
We need to ensure as well social interaction and the reduction of the mental health-related diseases, having more green spaces in our cities. So all of these healthy urban planning, transition to clean sources of energy, and sustainable food system is our health agenda. But and nobody can say that there is not a health business. It is.
But now it's a key priority of WHO.
Yes,
it's in our general program of work. But WHO is actually also, like the rest of the global health community, now struggling with challenges in funding and support. How do you see that going forward in keeping these priorities?
Certainly the situation is challenging, but our strategy is not changing. And we need to use, as I say, our influence. Sometimes influence doesn't require a lot of financial resources. Our voice needs to keep very strong, very appealing in the sense of having very strong arguments, and we have it. I think quantifying those health benefits at the climate negotiations, making sure that as the health system we contribute to decarbonize, and proving that this is very rewarding, and not only is good for the environment, it's good for the health of the people, and to reduce the bill that the hospitals are already paying, because we are already paying the price that will require a good climate change adaptation. And you know, the investment on climate resilient health system means nothing else than basic public health intervention.
Yeah.
So it's a very common sense investment. Making sure that our health systems will be more resilient to climate change means more epidemiological surveillance, different ways of preparing our health centers, looking at diseases that will be associated with the conditions created by climate change, more training for our staff. I mean, interventions that, after all, are nothing else than common, basic public health interventions, good to invest on it.
Sure. So you worked 20 years environment, health, and now also climate change, and more than 30 years in public health. What are the big achievements? What are you most proud of in your career, Maria?
Well, I think on environmental health we have many things that, but you know, when it's about primary prevention, you don't see immediately the benefits.
Yeah.
You don't quantify it. But I think removing lead from gasoline was an incredible environmental health success.
Yeah.
Or mercury, all the treating mercury. You have now standards on occupational health to protect workers from exposure to certain chemicals. We have air quality standards and legislation. The European Union has just approved a directive on air quality. So we have a lot of people gaining access to safe water and sanitation. Many things that have moved, and you will not see it on the health lines because you are preventing, not delivering. But a lot of challenges in front of us. Endocrine disrupting chemicals is an issue.
Any regrets in the last 20 years? Anything you sort of wish you would have done?
I definitely regret not to have achieved access to for everyone on water and sanitation. Is something that I don't have explanation for that, because it's something that the society has been done. Regrets of not having maybe the resources to do more in endocrine disrupting chemicals, or the impact that electronic waste will have in our health. Big issues like on plastic, what plastics represent for our health. So the agenda on environmental health is huge. Regrets is that I will love to have convinced more the governments and the negotiators at COP and others to invest more, because this is the best common sense, cost-effective agenda ever.
But you can still do that. And now the current challenge, the current crisis that we've touched upon to global health, it's a crisis of funding and support to WHO and the work we do, but it's also broader than that. It's also in many ways a challenge to the values, the principles, the science. I mean, many examples. The US government is also dissociating itself from the Paris Accord on climate and even the SDGs, etc. So how do you see that? Any future for multilateralism?
Listen, multilateralism has to exist, and otherwise our society will lose completely a wise approach. So I cannot imagine a world without this collaboration. We can call it as you wish, or we can change, or we can, you know, the society goes sometimes on a pendular movement, so maybe we are now here and we will be there. But I cannot imagine a world where we don't have collaboration. And even more now. And it will be really against all the technology we have. We can't avoid to communicate, to collaborate, to have support to each other. And this multilateralism is what it's giving us. And I believe so much on global health, so I'm sure that the global health will be the argument that will bring us back again on having a very good global health architecture, the one that responds to the challenging and growing needs of our citizens.
And still with a strong role for WHO as in our special mandate.
Definitely, definitely.
Thank you very much, Maria. Thank you very much for joining me here in the studio, and thank you very much, everybody, for joining this episode of Transforming WHO. And please stay tuned on this channel for upcoming episodes.